time for regrets. I've been flying from town to town, from London to Taiwan.
Good afternoon, everyone. My name is Emily, along with my partners Kiera and Autumn, and our research is titled Barriers to Quality Mental Health Care for Women of Color. The Centers for Disease Control reports that 11.2% of adults experience regular feelings of worry, nervousness, or anxiety, and 4.7% of American adults experience depression. Knowing these percentages of Americans experiencing common mental health disorders equates to 56.8 million physician office visits that then often lead to mental, behavioral, or neurodevelopmental disorder diagnoses. So while the rates of common mental illness in African Americans truly are similar with those of the general population, different disparities exist in regard to mental health care services and accessibility rates. African Americans experience underutilization rates in both seeking care and follow up care, different patterns in use of care as a result of socioeconomic inequities that influence cost of care, health insurance coverage, and proximity to providers. African Americans also experience barriers to care regarding different racial stigmatization and discrimination barriers that make finding and receiving care a more complex process. Yet in our research, we focus not only on the barriers to care that African American adult women experience in general, but we also took that a little bit more in depth and examined how those barriers specifically affect women who are experiencing postpartum depression. So, postpartum depression is a really serious and debilitating illness that affects approximately 10 to 20% of women who give birth. And very similarly to the rates of depression, available evidence suggests that rates of postpartum depression does not differ by race and ethnicity, but disparities do exist in access to care and follow-up care. Differences also exist in postpartum depressive symptoms reported by women from racial and ethnic minority groups and may reflect differences in cultural expectations and perceptions of both motherhood and mental health. So in this process of accumulating research, we will focus on research that is kind of twofold. One, an examination of the racial and ethnic barriers that occur for African American women in general. And second, examining how these factors impact women experiencing postpartum depression. Our work as a whole was really aimed at trying to understand what degree unmet need in mental health care for women of color is a result of race, and a little bit more specifically, identifying the race-specific barriers that make it challenging for those experiencing postpartum depression or common mental health disorders to receive care, and not only that, receive quality care. So our research examined 3 specific factors in order to better understand this kind of complex topic. First, we examined the barriers that women of color experience when it comes to receiving and accessing high quality mental health care. Second, kind of an extension of our first factor, we looked at specific barriers more in depth regarding SES and lack of insurance. And then lastly, understanding the specific stigmatization and discrimination women of color experience when receiving mental health care for postpartum depression and common mental health disorders. Our specific research hypothesizes that experiences of race-specific barriers to equality mental health care, as well as racial and cultural barriers and patterns of postpartum depression-related care, will result in unmet need of quality mental health care in African American women. Before I explain the results of our work, we wanted to explain for a moment the ways in which we conducted our research and found our sources and data. When conducting the systemic literature review, we used the source engine PubMed because it provided us with reliable scientific data and different studies. Some of our search terms included Black quality mental health care and barriers, women of color and mental health care barriers, SES and mental health care barriers, and women of color and mental health stigmatization. We had some different inclusion and exclusion criteria, Specifically, our exclusion criteria included studies on children, research done before the 2000s, and different pharmacological interventions for mental health services, as well as avoiding meta analyses. The specific findings provided us with a really in depth examination of unmet needs. And we will explain each factor a little bit more specifically, starting with our first factor, and that will be talked about by Kiera.
Recent studies have demonstrated that there are racial, ethnic disparities in the mental health care system when it comes to people of color. These studies have been suggested that there is an increased risk of common mental health disorders such as psychotic disorders and depression in Black minority ethnic communities. So when it comes to non-European immigrant women, they have been seen to have a higher risk for suicide because of a cultural stress. I will put a definition on what a cultural stress is below. Um, so, also, women of color have been disproportionately affected by PPD, postpartum depression, because of lack of income and lack of insurance. So, the intersection between mental health service seeking behaviors and racial discrimination and stigmatization results in largely unmet mental health needs and African American women experiencing common mental health disorders or postpartum depression. Many things need to change to make sure that women get their proper care, no matter if it's women of color and people who are not women of color. Everyone should get the proper care that is needed to protect the woman and her child. There are many barriers that Black communities face, and of course, people of color face in the community. Um, there are many things like that prevent them from having high quality mental health care. So that is one of the things are um, doctor and patient relationships. When you are going to the doctor, you one need to trust your doctor, two have good communication between yourself and your doctor, and three be able to describe your symptoms or your concerns to your doctor. If your doctor is maybe speaking in a language, saying certain terms that you do not understand, and you do not ask what they mean, or they do not take in consideration of, you know, not saying that they should talk to you like you're not intelligent, but they need to say things not that they need to say things that basically you can understand. Also, certain things like understanding that people of color go through different things. People of color also have different barriers to many things. So, one thing that I feel like, and that I've read that is a barrier besides that is the waiting times. Like I said, communication, response to needs is a big one. And also, like I said before, the language and awareness to services. People need to be aware of the service so that they can get help. If they're not aware of certain services, they're not going to receive or be able to access the proper care that's needed. And also, if they do not have the funds to, pay for those things, having awareness and having access to these certain resources that will help is a key to increasing the quality mental health care. So, again, there is from reading and also from talking to people who have experienced certain things, I've seen that there's a distrust in the Black community when it comes to the mental health field. Um, there's like a distrust in the mental health industry because of negative past, stories and also maybe people's own experiences. So there's a lack of diversity in the mental health care, causing certain people not to feel comfortable to reach out. So, for example, a black male may want to see another person of color for mental health help, not because the person doesn't look like them, but because the person may not understand their struggles. For someone to help you get through your struggles, you have to basically feel this sense of, this person knows what I'm going through. They're helping me through their experience or people that they know's experiences. Also, women of color seem to be hesitant to seek for help because they are at fear of being judged, and also they don't want people to say that their feelings towards something isn't that serious. We know that all people do not, dilute others' issues and concerns. However, it has been seen and it needs to be stopped. There is a cultural stigma of mental health illness causing women to hold things in and try to remain strong. Now, I say try to remain strong because even though someone is holding things in and they feel like they're keeping it all together, there's still things in their brain and mentally that they are going through while trying to keep things in and not seek help. We all need, sometimes someone to help us up, and some need help more than others. But when we are literally just trying to be the house and try to be the powerhouse of everything, sometimes we will not be able to remain strong, even though we try to keep telling ourselves to remain strong. Really, what that sometimes does, or it can do, is it can hurt you mentally. You can, maybe be at risk for anxiety, or be sad, depressed, or, certain mental disorders that will that can be caused by stress. A lack of insurance, or not having enough funds, like I said in previously, can it can lessen the chance of getting high quality mental health care, because like we all know, even though money shouldn't be your main focus of many things, and money can't bring happiness at all times, money can get you the high quality things in general that's needed. So I have, on this document, I wrote a few possible solutions for these issues. And these issues can be maybe solved, or it could try to be solved by discussing mistrust openly with providers so that they can possibly change their system and how they go about things. It doesn't always start at the top. It can sometimes start at the bottom. So if someone who is a mental health provider, even if they're not the type of people who, dilutes other people's, people of color's concerns, they can also try to maybe talk to their colleagues, talk to their, other mental health provider friends, and let them know this issue that is going on in the Black community. And mental health is very, very important, and mental health should be taken very seriously of all people. But sadly, we see that there is a lack of mental health care when it comes to quality care in the Black and women of color and people of color, and all across all boards. So starting from the root of the issue, like I said, starting from the root of the issue on why so many people and not as many people are able to go to the doctors and feel comfortable to go to the doctors. We can say the statistics on how many people go to the doctors and how many people are diagnosed with mental disorders. But then if you just sit and think, how many people are not diagnosed? How many people think that they don't need to go to the doctors and the doctors will not help? How many people are afraid to reach out? How many people are afraid to even say that they need help? There are a lot of people who are afraid to say that they need help. So that's one thing. And also, having Black mental health conversations within the Black community. Talk to your friends. Talk to your, co-workers. Talk to whoever about the certain things that are going on. Because some people, even Black people and people of color, may not know what's going on. They may not know that they may need to get help for and seek help for a certain thing. They may not know until people talk and share experiences and share stories and share things that they've overcome. Another thing that can be very helpful, that can possibly be helpful, are more outreach programs and providing funding for people who can't afford mental health care. I know there's, outreach programs out there, but, maybe increasing them may help and get people to realize, maybe think, why are there so many outreach, programs for mental health care? Maybe get the people of color thinking of, maybe there really is a need for being educated on mental health and understanding your own mental health, and also getting treated for things that you may think is normal. So a solution also could be providing more opportunities, support, and access for people of color. One of the major reasons that I feel people of color may not be able to perform to their fullest potential is because money, funding. If someone doesn't have enough money, if their parents do not have enough money, what are they going to do? Some people drop out of high school and start working to provide and help provide for their family. Some people graduate from high school and have so much potential, but they cannot go to college because they do not have the funding. Some people, even with scholarships, still can't meet the other half that is needed to, get into school. So maybe providing more things like that can help, because maybe there would be more doctors and more paramedics and more firefighters who are people of color and who can go to school and be, who they want to be and where they want to be. If that was one stressor able to be removed from their mind, there would be a higher chance that people of color would be going to school for crucial healthcare fields. Also sharing personal stories on how they got there, helping other people know, I was in your position, but look at where I'm at now. Sometimes hearing how people got there and the struggles they went through helps other people not give up hope. So as I reflect back to the Crossing Bridges Summit that my school has, Penn State Greater Allegheny, we have the Crossing Bridges Summit, and the one talk that we had, it talked about the need for more African American or even people of color in mental health fields.
Did my factor on socioeconomic status in relation to accessing health care. As we know, socioeconomic status, or SES, is a measure of one's social standing, which includes things like education, income, and occupation. SES can be a big contributor to accessing mental health care. All of the research I found showed that women of color struggle to access quality mental health care because of the disparities and barriers that they face. For example, one study done in 2007 found that women who are disadvantaged by poverty and are a part of racial and ethnic minority status are more likely to experience depression than the rest of the US population. This could be due to discrimination, lack of insurance, lack of knowledge on where to access care, or lack of income. Lack of income can be a common stressor that women face during and after pregnancy, causing postpartum depression. According to the Economic Policy Institute, the median and average wealth of white families is 12 times their African American counterparts. This is a big problem because women of color are facing higher rates of postpartum depression because of lack of income and are also less likely to receive care because of the same reason. Another problem with seeking mental health care is lack of insurance. A study done in 2017 found that African Americans had lower insurance coverage rates at all ages compared to their non-Hispanic white counterparts. Without insurance, receiving mental health care can be very expensive. So one thing that I think we can do to fix this problem is to make insurance more affordable or to make mental health care less expensive. Insurance is a huge part of accessing any kind of mental health care, and without universal plans, it is hard for everyone to be able to afford it. If we are not able to improve this issue, then I think our next step would be to try and lower the cost of mental health care so that people are able to afford it.
So our final factor and finding is that racial discrimination and racial barriers lead to differences in unwillingness to seek treatment. The findings of our research really discussed in depth how experiences of past discrimination are really impactful in contributing a strong racial identity. For African Americans, a strong racial identity was actually shown to be more important and impactful than structural variables such as education and income when explaining the differences in unwillingness to seek mental health care. A little bit further, African American individuals experiencing depression and other common mental health disorders are often met with high levels of stigmatization in the form of public stigma or internalized stigma. So, public stigma is really defined as those negative beliefs, attitudes, and conceptions about mental illness that are possessed by the general population or community, and then which lead to stereotyping. And internalized stigma is defined as the application of the population's negative beliefs about mental health illness used to belittle and demoralize oneself. So this is a really important factor which influences treatment-seeking attitudes and behaviors, and then results in less positive attitudes towards mental health seeking overall. The understanding of this stigma means that we can kind of apply it to women who are experiencing postpartum depression as well. The stigmatization surrounding not only mental health issues, but women of color that are experiencing postpartum depression makes it incredibly hard to receive service and leaves women to go for years untreated. Research shows that many pregnant women with mental health concerns fear being perceived as crazy or worry about losing their children should they disclose their symptoms. Among African American women, there's evidence to suggest the need to tough it out or be a strong Black woman, which then really discourages treatment-seeking behaviors. There's also evidence to suggest that women are more likely to report somatic symptoms such as head or stomach pain rather than mood symptoms like sadness or irritability, likely because those symptoms are more culturally acceptable than the mood symptoms. Fears of stigma, African American mothers is further complicated by negative perceptions of mental health professionals and psychotherapy overall, really as well as the belief that medication is not an effective treatment for depression. So with that factor in mind, there are some different strategies that we suggest to optimize diagnosis and treatment that involves this element of destigmatization for women of color. So numerous Strategies have been developed to reduce mental health stigma and increase education about postpartum depression, namely through contact and education. One way to do this really is through increasing patient trust by providing psychoeducation about postpartum depression, which includes describing symptoms, normalizing the condition, and sharing different statistics on the high prevalence of postpartum depression. It also really involves telling women and African American women that it's treatable and that it's one, not their fault, and two, can be treated in a not stigmatizing, open way. Public campaigns are also designed to increase contact and education, but kind of fail to provide a trusting interaction between patient and provider. So, psychoeducation with health professionals is really a crucial factor of this, as well as deciding when and where the best place to deliver this information about postpartum depression and have open conversations about postpartum depression and where those conversations can happen. So therefore, healthcare providers who treat women experiencing postpartum depression really must need to be equipped with tools that allow them to provide necessary resources and information that they need, and talk about the effectiveness of treatment and costs and privacy. So that kind of wraps up our three factors. Kira and Autumn are going to kind of discuss this and conclude our work.
Not only is it important to listen to, value, or protect people of color, it starts with understanding them. How are you going to value something that you don't understand? It makes sense. But start with understanding them. We need to eliminate as many disparities as we can. Look at the roots of the issue instead of just the event at a time. More people need to speak out on this issue because, again, awareness spreads when people speak out and tell what's going on and tell what needs to be changed. Voice it, express it on all social media, to your friends, verbally, whatever. A barrier within the Black community is the effect of trauma being normalized. I'm going to say that again. A barrier that for Black people in the Black community is the fact that trauma is normalized. Certain things like anger, stress, and certain things like that. Yes, stress is good sometimes. There's good stress and there's bad stress. But there's certain things where it's been normalized to where people don't cope the right way to stop the rolling ball from creating something worse than what it is. People's feelings are true. People's feelings are real. People feel how they feel, but certain things need to be looked at as, okay, this is not okay. How can I change? How can I change this? Because I don't want this to end up worse. How can I fix this issue? This is not normal. This is not okay. So, women of color can get so hung up on being a strong Black woman, taking care of everyone else around her instead of taking care of herself. The people who care about you want you to be okay. They want you to be okay. But if you're not taking care of yourself, how are you going to be okay? You can't just, you have to worry about yourself sometimes. You have to take care of yourself sometimes. Self-care is very important. So maybe trying to create this domino effect that is good, a positive domino effect that helps women of color and her children and her children's children. So through all these articles that I've read on women of color, people of color, Black mental health care, all that, I've seen that there's really a distrust in um, the mental health care, um, and and um, women of color being under the radar, and when it comes to having awareness of what's going on with their mental health. Every ethnic group and racial group has different levels and different labels of their stressors, and socio-demographic, pre-pregnancy, and other characteristics that differ from one another. It is easily able to determine the correlation between postpartum depression and stressful life events. Um, Look at everything around us.
Women of color struggle with higher rates of depression and other mental illnesses because of the barriers and disparities they face. They also have lower rates of accessing quality mental health care for these problems. We need to eliminate as many disparities as we can for women of color so that they can access quality mental health care. We need to be more educated on this issue and help educate other people so that we can work on fixing it. We need healthcare professionals and future healthcare professionals to speak up so that we can make a change. Women of color should not have to suffer because of the broken system that's in place. And that's all.
Very good, very good. I enjoyed that very much. So I think it was Emily threw out some statistics at the very beginning. Could you give those to me again? They were astonishing to me.
Oh yeah, sure. Let me just look. I had it written down. I think it was 11% they said of Americans experience like just regular feelings of worry and nervousness. And then it was almost 4.5% of people are diagnosed with depression. But, that's hard to even say that that's accurate based on even what we talked about, the barriers to being diagnosed with depression in general and receiving treatment. And then it was 10 to 20% of women who experience postpartum depression, but also could easily be underreported, which I assume most of the numbers are. Yeah.
Yeah, because when you said that, I thought I would swear that it was higher than that. I mean, I've never heard the numbers, but just
Yeah, I think realistically it is higher, but based on, what the CDC says, that's kind of what I used.
Oh yeah, no, that's absolutely true.
But a lot of that stuff is just so underreported.
Yeah, absolutely. So what was the difference between white women and African American women or women of color in postpartum depression? Was there a reported difference? You may have said it and you may not have.
When I kind of said the statistics were similar for pretty much all racial and ethnic minorities compared to white, but the difference is the access to care. So overall, people experience the same levels. It's just when it's easier to be treated and diagnosed, then, obviously outcomes are a lot better.
Right. Well, what I was thinking was you may not see a difference in the numbers, but that could be because it's underreported. And that's kind of what all of your work is suggesting, ladies, is that it's just not, women of color aren't going to get treatment, and so they're not counted. And therefore, we just don't know how.
Yeah, exactly. Mm-hmm.
Yeah. Fascinating. And so one last question. So it seems to me like the answer to all the problems is education of people on all
Yeah,
sides.
education on like all aspects of it. It's not even like one specific group we could say, I feel like this needs education. I think just as a whole, like there's so much that needs to be done, just not only surrounding mental health care, but um, addressing racial and ethnic minorities, addressing these barriers to care, and why should some people have really great care for mental health and other people don't, and go from there, I guess.
Certain things that some people need to understand is when people bring awareness to people of color and black people, we're not saying that we are the only ones that matter. We're saying that we're voicing that we see the lack of care overall when it comes to mental health care, when it comes to regular health care. The quality of care isn't as high as it should be for people of color. And that's not putting anyone else below us, but we're bringing awareness to this issue. And that's what needs to be understood. When clients who are high risk don't seek help, know how to communicate their issues, and the many other barriers that interfere with women of color receiving high quality mental health care, of course, like anything else, postpartum can get worse. There's certain barriers that I've seen. Barriers in the Black community, and barriers in the mental health field.